What's up guys, Brad here from Piney Grove, and 6 months ago I had reverse total shoulder replacement. I'll show you the scar. It's about 8 or 9 inches long. 2 weeks after I had this surgery, we did a video out here and we talked about the events leading up to the surgery, how the surgery went, and then that initial 2-week recovery period. We'll link that video up here, but a quick recap is I had the surgery, I had about 3 or 4 days of pain, and then I had 2 weeks of in-home physical therapy. And after that video, I had physical therapy at a local gym. That's where my physical therapist had her office, so I would go there 3 times a week for physical therapy. And that's what I'd like to talk about, the events from 2 weeks post-surgery to now 6 months post-surgery, and just give folks out there that are contemplating this surgery some confidence in what they might be able to see. I will do a disclaimer that says I'm not a surgeon, I'm not a doctor, I'm in no way associated with the medical field. I listened to my surgeon and the advice that he gave me and what my physical therapist said. Your surgeon may give you different advice, and by looking at the comments in that first video we put out, a lot of people are getting different advice from their surgeons than what my surgeon gave me. So all that to say, don't rely on a guy on YouTube to give you medical advice. All I can give you is what my experiences were, what my surgeon told me, and that's how I got to this point 6 months later. Let's go over to the shooting range and talk about that for a minute, because I'm a hunter and having this surgery on my dominant side, I didn't want it to affect hunting for me in the future. So I've got some interesting updates about that. And the reason I wanted to come over here is talk about the recoil of a high-powered rifle. So I'm a deer hunter and I shoot a 270 rifle. It's very similar to a 30-06 as far as the cartridge, but has a little bit less kick if you're more familiar with the 30-06. And that puts a lot of pressure on your shoulder. And I was really worried that I wouldn't be able to hunt this past season. So my surgery was in August 18th. Our deer season opens for gun season on Thanksgiving, which is about 3 months from surgery. That was one of my concerns. Dr. Dietrich in Panama City Beach, if you're anywhere in the local area, I hear people travel to him to get hip surgery and shoulder surgery. Great surgeon, gave us his personal phone number after the surgery because I had some swelling and stuff I was concerned about. But I met with him after, it was a few weeks after that video, and I said, Doc, I said, I'm ready to hunt. Can I hunt? And he said, no problem. He said, there will be no problem with that impact. You're not fully 100% healed until 1 year, but you're pretty darn close by 6 months, but you can do a lot at 3 months. And I can tell you that on December 21st, I think it was before Christmas, I shot a doe. No problem, no impact to my shoulder. I can tell you that when I was looking through the scope, as they came out, I kind of had some reservations about it. I was worried about what was that going to do to my shoulder because I hadn't had any complications up until then. I made the shot, I dropped the doe, and I even picked it up and put it on my tailgate with no problem. About a month later, I shot a buck as well. So I've shot a high-powered rifle a couple times and it's had no ill effect. So hopefully that gives you some sort of data on how much your shoulder can take afterwards. That was one of my big things with him before the surgery. When can I hunt again, or even can I hunt again? And I'm living proof that you can. Again, listen to your surgeon. My wife is back there trying to photobomb me. You see her back there in the dirt pile? This is what she does. Mrs. Piney Grove, her name is Deb, if you're not familiar with our channel. We've been doing social media for a couple years because she's like Waldo. She's just always there.
You ruined my fun.
She said I ruined her fun. She doesn't have a mic. If she's gonna photobomb me, we're gonna get her in the camera. So what I've been talking about is my shoulder surgery and how I've recovered. And at 3 months, I was able to shoot a deer, but had physical therapy. And so you were helpful in some of that stuff, and you saw me before the surgery and you see me after. Just real quick, what do you think about it? Because I know people that watch this are going to be wondering, is it a surgery for them? Should they do it? What have you heard from me, like from your side of it?
Well, from my side of it, the entire time I've known the man, he couldn't raise his arm above here, right?
Probably not even that high.
Yeah,
I was probably
here.
stuck right in here.
So he couldn't raise his arm, but it didn't stop him from doing anything, but he was in pain and his mobility. The recovery that this man has gone through in a matter of months was amazing and astounding. I mean, I didn't feel the pain. Obviously, I felt pain for him because I love him, but I didn't physically feel. Aw, surprise. Here, this just in, I love my husband. But the recovery and watching him go through it and seeing how quickly he healed and how well he did, I got a little aggravated with him a few times because I felt like he was, doing things I didn't want him to do, but he followed the doctor's orders and the doctor said it was okay. And if 6 months, I mean, look, 6 months, you'd never know. You'd never know. So I say do it.
She's no surgeon either. She's no doctor, and she's no physical therapist.
No. I say do it from a wife's standpoint. I say do it.
Let me turn off her mic.
If your husband are complaining,
I got her mic, look. I moved over to the garden for this shot because a big thing about us out here in Piney Grove is working the land. And what I didn't want is to have a surgery that would prevent me from operating equipment. Pretty soon after that 2-week video, I was running our mini excavator and running this tractor. The limitation on your right arm is real small in the beginning, like 1 pound or something like that. So during my physical therapy, we worked with 1 pound weights, and then like after a week or so, we did 2 pound weights. And I was going to physical therapy 3 times a week. So Monday, Wednesday, and Friday, it was a good hour or so. And we do a lot of stretching because initially out of surgery, once all the swelling went down, like Deb said earlier, I was kind of stuck here. I couldn't reach above my head, and I had to drive and reach things in the cabinet with this arm. But this arm was stuck down here, and it couldn't do a lot of things that most normal people could do. And I was constantly in pain, just constantly in pain, especially if I exerted myself, like shoveling, weightlifting, things like that. So for physical therapy, the first thing she would do every day was stretch me and just kind of get the range of motion back, because all of your muscles over the years, for me, it was probably 20 years worth of dealing with a shoulder that was not functioning properly. I'd had 2 surgeries prior, 2 scopes prior for rotator cuff and slap lesions, and my muscles had just totally changed in my body so that they didn't want to let go after the surgery. So my shoulder was still coming up awkwardly. So she would like isolate my shoulder and then stretch me and get my muscles working properly. And also the geometry of a reverse total shoulder is totally different from your anatomical shoulder. So your deltoid, which doesn't really get involved in your shoulder movement, is now doing most of the work. And so you've got to train that muscle. So you can't throw 5, 10, 15, 20 pounds at it right away. So we would stretch, and then we do some weights and some rubber bands and things like that. And I did that all the way from, let's say, September, October, November, December. I think sometime around the end of December, I stopped going to formal physical therapy and then started going to just my own physical therapy once I learned what I could and couldn't do. And when I talked to the surgeon, he said that you're probably limited to about 45 to 50 pounds even after you're fully healed. There's a lot of people out there that have had this surgery that were former bodybuilders or former weightlifters, and I was in the military, so I did a lot of exercise. I played a lot of sports, a lot of throwing sports like flag football and softball, did a lot of weightlifting, and I've basically given that up. I do go to the gym now, but I use very light weights. I don't use free weights. I'm not an overly big guy. I'm 6 foot, 200 pounds, and I was bench pressing 350 or better. And that was with a bad shoulder, and that obviously didn't help it. But now I don't bench press at all. It's not a recommended practice, but you will see plenty of people on YouTube that were big bodybuilders before. They had the surgery, and they're back to doing those heavy weights. It's not that the shoulder can't handle it. It's just that the shoulder only lasts for so long. So I don't want to go through this surgery again. I had the first surgery at 56 years old. I want that to last as long as possible, hopefully until I die. As the implant that they put in there changes in technology and what it's made of over time, there's just not enough data to say how long will it last if you do this, if you avoid this. So what I'm trying to do is protect it. I don't heavy weightlift anymore. I use light weights. I'm not going to be throwing footballs and baseballs anymore, although I can do the throwing motion. I can do that. I could not do that a few months ago before the surgery. So I can do that, and I actually practice that, but I don't actually throw anything because I don't want to wear out the joint, so to speak. But I want the mobility, so I continue to stretch and I continue to kind of reach and do things as if I was maybe playing sports or being more active, just so I keep that range of motion so my muscles don't lock in. So this is what I look like after 6 months of surgery. This is what I can do with this arm. It doesn't mean that you won't be better or you won't be worse. Down in the comments of our first video, there was one kind of odd comment that said, doctors are pushing this surgery because as the one size fits all. They can take x-rays and they can do imaging, but until they actually cut through the muscle and get in there and look at that joint, they don't know what can be repaired and what can't. And I've had 3 or 4 different surgeons on my shoulder, and everyone has said the same thing. This is what we think we're going to do when we get in there, but once we get in there, we're going to try and preserve everything that you have that God gave you rather than putting something artificial in there. While the imaging said my rotator cuff was gone, when he got in there, if he could have repaired it, then maybe I would have been immobilized afterwards. But because my rotator cuff was so destroyed and it was so thin, he couldn't make any repairs, I could move my arm immediately after surgery. I mean, I was out of a sling after 1 day, and in the comments in our other video, there's people who are like, my surgeon said I need to stay in a sling for 3 months or whatever and immobilize it. Listen to your surgeon. Maybe he got in there and he was able to repair something that if it heals is better than me with a completely destroyed shoulder that there's nothing to heal. So just go on and use the artificial joint that's in there. So that's just something that I think everyone needs to take away from these YouTube videos on people that have had surgeries is every body, like every physical body, is different. And I have always felt in my life that I've healed well and I do what the doctor says. And I research just like you guys do what other people have gone through. But at the end of the day, I'm going to listen to the guy who has been through the schooling, who has the education. Once the surgeon gets in there, he's likely going to do what's best for you and not just try to sell you a joint replacement. That's my experience. Maybe other people have had different experiences, but you can certainly, look up your surgeon. You can go to different surgeons, but this one gave me confidence that he was acting in my best interest. Back to things that I can do and I can't do. I literally, at the 6-month mark, don't even think about my surgery anymore. When I go to jump on the tractor, when I go to jump on the excavator, when I go up to a pail full of water, I don't even think about it. I'm right side dominant. I just go and pick it up and I have no pain. I have no issues. I can recommend, if you have a lot of pain and you have a lot of issues, that this surgery could possibly help you. It has changed my life to the point that this shoulder gives me 0 pain. I do have arthritis now in this shoulder. I can sleep on this shoulder now. I couldn't do that before. I can lift things, I can reach, I can drive with this hand. All the things that I wasn't able to do before because of the restriction of motion and also the pain, I can now do. And that's huge to me, and I want to protect that. So if you did have to have a follow-up surgery, they don't have to drill in your bone and put all those pieces of metal in. Those pieces of metal should still be intact, and then they just replace that buffer in between. But that's still cutting through all your muscle mass and through your skin here. It's not a little deal, it's a big deal, so I'm trying to avoid that. Now, I have got some questions on, can I ride a horse? Well, you can do anything that you could do before. It's just that if you fall off a horse and this shoulder impacts the ground with your body weight, then it could dislocate it. It's not going to break that metal, but it could, it could crack your bone. You could get a fracture in your bone. It could dislocate. There's things that can happen to it, but what I was told is this replacement joint is as strong as my natural God-given joint, and that's apt as well to dislocate and to break if you were to fall off a horse or get in a car accident. So if you have any questions about anything about my surgery, if you have any questions about my recovery, just ask in the comments down below. I can tell you what I went through and what my experiences were, but just from this video, I can tell you that I recommend the surgery if you're having pain. I recommend putting off the surgery to the point where you have no range of motion and you're in constant pain. If you can manage your pain with over-the-counter medicines like Aleve, I was taking a lot of Celebrex that was prescribed to me, but if you can manage that pain with that, manage that right up to the point to delay your surgery to as late in life as possible. That would be my advice to you, and that's what I did. I just dealt with the pain until it got to be where it was affecting my quality of life, and now I have all that back. I do have some restrictions in motion. Let me go over that before I close out the video. So this arm and this shoulder is screwed up a little bit too, but I can reach behind my back. Not as much as a normal person with a perfect shoulder, but I can reach behind my back. Problem is, I'm right-handed. So in my right hand, with the reverse total shoulder, that's about as far as I can reach. And I told the surgeon that, and he said, you could work on that. You can stretch it and you can work on that. What you don't want to do early after the surgery is work on that too early, because you could dislocate it because the muscles aren't used to it. But that's as far as I can reach. Could I reach farther if I worked on it? Maybe, but I'm not concerned about it. That's more than I had before. If I want things behind my back to do belt loops or stuff like that, I'm either going to have to get my wife to help me or put the belt in my pants before I put them on. The other thing is hand strength. I've noticed when I'm cutting that downward pressure when you're cutting, because of the geometry now, you know, if it's a hard potato or something or a hard onion to cut, it's like you're pushing and nothing hurts, but you don't have the power that you used to. I am so right dominant that I can't use my left hand to cut, so I just kind of power through it. But I did notice that, and I've also noticed a lot of lack of hand strength. Talking about tractors, tractors have what's called a PTO shaft, and I noticed the other day when I'm pushing the PTO shaft on, I actually have to get my left hand a lot more involved because the right hand is just weaker and it can't push like it used to be able to. And it also can't grip as strong as it used to be able to. Can those be overcome with exercises and weight training? Maybe. I'm just letting you know what I've experienced. And the last thing, and this is kind of weird, but I'm an outdoorsman, so I'm outside a lot, and when I see a mosquito, I'll go to hit it. And I can hit my chest, but with this one, I can really smack it. With this one, it almost like stops, and that's because it doesn't want to rotate this way. And I showed the surgeon that, and he said we could work on that, but there are just different geometries in different people's bodies and the way they work, that motion is not one, the way that they put the implant in that helps me do that. Now again, I can tap my chest, but for months I'd see a mosquito and I'd pat and my hand would literally like stop right there. So those are just some weird things that I'm experiencing, but day to day, I am much better off post-surgery than pre-surgery. And if you're interested in seeing what I've been doing for the past 3 or 4 months, just go back in chronological order of our Piney Grove videos and watch them, and you'll see what I've been doing. I don't think you'll be able to see in those videos or be able to detect that I had reverse total shoulder replacement. But that's all I've got for you guys today. We sure appreciate you watching. This will be our last shoulder video. We're going to get back to Piney Grove stuff. If tractoring, excavating, planting gardens, mowing, if that's stuff you're interested in, consider subscribing. We'd love to have you along with our journey. But until next time, y'all take care out there. And remember, life's short, tractor hard.